You ever notice how in this country the protections that we take for granted only stay in place until somebody with power decides they want to experiment on the public again? And somehow it's always the youngest and the poorest and the least protected who get hit first. That's exactly what's happening with this new move to drop the hepatitis B birth dose for newborns. Now, medical experts across the board, pediatricians, liver specialists, public health leaders are calling this change dangerous, not controversial, not debatable, dangerous. Why? Because the vaccine has wiped out more than 95% of childhood hepatitis B in America since 1991. That's one of the greatest public health wins we've ever had. And listen, most families don't even know their hospital screening can fail. They don't even know that one missed test, one paperwork error, one overworked nurse can mean a baby goes home exposed to a virus that can ruin their liver for life. Black families, poor families, immigrant families, the folks with the worst access to follow up care get hit hardest. But once that door is open, everybody is at risk. Diseases don't check your zip code before they take a life. This change didn't happen because new science came out. It happened because RFK Jr. wiped out the original CDC committee and stacked it with vaccine skeptical appointees, some of whom don't even have clinical experience. Scientists were sidelined, evidence was ignored, and people's choice was used as a buzzword to mask the fact that this decision goes against every major medical organization in the country. Look, vaccines can be complicated. People have real fears, real questions. That's normal. But tossing out a decades old life saving policy without evidence, that's not choice. That's gambling with newborns to satisfy an ideology. We shouldn't be fighting over whether children deserve basic protection from a deadly virus. We should be fighting to make sure no family, black, white, Latino, Asian, rich, or poor, ever has to bury a child because a preventable disease slipped through the cracks. Now, understand that this isn't final yet. The CDC leadership still has to approve it, states can still reject it, families can demand the birth dose, doctors can keep recommending it. We can call our representatives and ask them one simple question. Do you trust politics more than you trust the science when my child's life is on the line? If we let ideology decide our baby's health care, we're handing tomorrow over to chaos. We deserve better. Our children deserve better. And this fight is just getting started. For a full breakdown of this and more, and to support what I do in independent media, please head over to my Substack, link in bio.